Ontario is going to be entering stage 3 ahead of schedule, 5 days earlier than expected, come this Friday. At least one member of the Ontario Science Table said that this was just too soon. Is this the right time?
Well, we're in a good place. Actually, when you look at a bunch of different data, the number of new cases per day continues to go down, slightly slower rate, but they're going down. Hospitalizations are doing well. Intensive care units, deaths are down, and so forth. I think yesterday in Ottawa there were only 7 new cases, so it's looking pretty good. I'm not going to quibble with 5 days here or there. What I do appreciate, I think, is the government's attempt to be very cautious. It's not a full opening. There are still limits in gyms and restaurants and so forth. And another 3-week waiting period to see what effect this might have. I think that's a good approach.
The Delta variant has been raised as a concern time and time again over the past few weeks. Really, it's currently accounting for 80% of the cases in Ontario. We are seeing it drive up case counts in the UK, despite the high vaccination numbers there as well. Are there concerns that the Delta variant is being taken seriously enough at this point?
I think so. I think it's being taken seriously. It is going to be the dominant strain for sure. It's well on its way to that. The UK situation is really worth watching very closely. Their cases have gone up dramatically, presumably due to this Delta strain. But their hospitalizations and deaths have not gone up as much as one might think. So I think with vaccination, there is protection against this virus. There's a lot of debate about how much protection there is, but I think there is protection. I'd just like to say that 2 things have brought us where we are today. One are the public health measures, masking, distancing, contact limitations, and so forth, plus the vaccination. Now, as we ease up the public health measures, we have to redouble our efforts on the vaccination so we don't lose ground.
Right, and on that note, Ontario's top doctor says that after stage 3, in order to get to stage 4, the province will have to wait 21 days before moving to that level, so long as 80% of eligible people have had 1 shot and 75% have had both. Do you think that the province can meet those markers?
Well, hopefully. Time will tell. We do have now a situation which what I call the eager vaccinators, the eager people who wanted to be vaccinated have been vaccinated. And now some of the hesitant people are beginning to be vaccinated. But that still leaves another portion of the hesitant people and the people who do not wish to be vaccinated, and they are unprotected. So how big that group is will determine how many outbreaks we have and how much transmission occurs in our communities.
Okay, that is all the time we have, but we thank you, as always, for yours. Dr. Ronald St. former Director General at the Centre for Emergency Preparedness and Response, joining us on this. Thank you so much.
Oh, you're welcome. Thank you.